As we mentioned earlier, today kicks off Sleep Awareness Week. So all this week, we'll have advice ranging from the medical industry to bed linens to sleep tech, everything to help us get the sleep we need. There are 3 common problems that can disrupt your sleep and have you dragging all day long. Joining us now to explain is Dr. Akash Anand with GNO Snoring and Sinus. Welcome back, doctor.
Thank you so much for having me, Jacqueline.
Of course. So let's talk about these 3 common sleep disorders, starting off with insomnia. What is it?
So insomnia is essentially difficulty falling asleep or difficulty staying asleep.
Uh-huh.
Now, a lot of us have at some point in time dealt with insomnia here and there, whether it's jitters before a test the next day, a big date, or some big event coming up. That's acute insomnia. Those are bouts of insomnia that tend to resolve themselves once those days have passed. Then, of course, there's what we call chronic insomnia. And that's when it gets a little different. Essentially, you're having bouts of insomnia for 3 times a week for more than a month, essentially. And when that happens, it can cause a lot of fatigue for patients.
Sure, I bet. So tell us a little bit about how we can cure that. How is it curable?
So the key is starting with a diagnosis. So a lot of people will tell, I'm tired throughout the course of the day. And then when we talk to them, we try to figure out, well, are you having trouble going to sleep, staying asleep? Do you wake up at night kind of gasping for air? And a lot of them will tell us, I just can't fall asleep. In this day and age, especially when you have all these devices, these tablets in the bedroom, a lot of people are constantly preoccupied. So one of the most common things we see is they don't turn off their equipment. Number 2, there's also medical problems that can cause this as well. There's a condition called chronic insomnia, of course, or rather secondary insomnia, which can be a result of other medical problems, pain, diabetes, other things that cause you not to sleep, but it's not the sleep that's the issue, it's those true medical problems that occur. And the starting point is to, of course, get them diagnosed properly and then get those treated as well. The key here is really resolving the fatigue when it comes down to insomnia. Medical therapies can be utilized. There's sleeping pills. Sleeping pills are definitely utilized to reduce the fatigue. And then there's other things too, like behavioral therapy. We talked about tablets, iPhones, that sort of thing.
Unplug.
You want to, bingo, unplug before the bedroom, and that can help also reduce that level of fatigue too.
Wonderful. Okay, so moving on to sleep apnea.
That's correct. So sleep apnea is one of the most publicized forms of course, a sleep disorder. It's basically your airway collapses at night while you're trying to sleep. You can see over there on the monitor, that's a picture of a normal airway, and those 2 air vectors show where air should actually travel.
Right.
For patients with sleep apnea, they have no trouble falling asleep, but staying asleep is the big problem. They will gasp for air at night.
Gasping for air,
Bingo.
right.
It's a very scary thing. There's loud snoring, and as a result, they too will awaken fatigue throughout the course of the day. So the diagnosis is real key. If a patient, if a viewer at home is noticing this, the first question is, am I tired in the morning? And if that's the case and their loved one is telling them, yes, you snore, you stop breathing, then a sleep study is really where we go to actually diagnose that as well.
Sure. Okay, and the third on the list is restless leg syndrome.
That's right. So restless leg syndrome has also become more and more prevalent as well. It's what we define as a sleep-related movement disorder. And in that individual picture over there, you can see what most patients will describe as a discomfort in their limbs. And it tends to occur from being recumbent for a period of time, i.e. in the fashion of sleep. And what patients will tell us is they want to just jot their legs, move their structures in order to release that discomfort. Now, a lot of things can cause this too, so again, a good medical assessment is important. Iron deficiency anemia can cause this. Diabetics have something called peripheral neuropathy. It's in essence tingling in the joints and the legs too.
I was going to say, does it kind of feel like your legs are asleep? Or?
And what they tell you is they want to just kick their legs to wake them up in a sense.
Right.
The problem is this occurs at night and they're not really aware of it. And what that can do as well is disrupt sleep, causing, again, fatigue in the morning. The real theme here is that no matter whether it's insomnia, sleep apnea, restless legs, these patients will awaken in the morning tired. And that's really the hallmark starting point to then determine, why am I so tired now? You can see here, of course, we have this actual apparatus. This treats sleep apnea. You can see it on the monitor over there. And what sleep apnea in terms of treatment is done, this is positive pressure. It basically stents open the airway, allowing you to then breathe and receive oxygen as well.
Right, so you're no longer gasping for air because your passageways are open. Right,
exactly.
Right.
It's stenting everything open.
That makes sense.
That's the most important thing from a viewer's perspective, to really determine, am I tired when I wake up in the morning? And then we try to parse out exactly what it could be when you talk about these 3 options as well.
Sure. And then I always think of, what about our partners too, our sleeping partners? I mean, they're obviously affected by this negatively as well. So it's not just a solitary concern.
Not at all, because ultimately they'll come in with them at times in the office too, and they'll say, you know what, he's not sleeping, but I'm not sleeping. And so that's the bigger problem too. So in essence, you're right though, this isn't a disease in isolation. These sleeping problems can affect not only the other person in the bedroom, but more importantly, that level of fatigue you just drag throughout the day. And it really can be something that is treated effectively and can be diagnosed really easily as well.
Sure. So unless you have something that's obviously a big stressor, like maybe you're studying for the LSAT or something like that, and you know that test is coming up, that will contribute to poor sleep.
Bingo.
But other than that, it is easy to diagnose, right? I mean,
It's very
the first
easy to
step is, I'm
diagnose.
tired, help me.
Bingo. And it really is just that clinical picture that we want to put together. We tell a lot of patients, keep a sleep journal. So ultimately, jot down the time that you go to sleep, jot down when you wake up, and hopefully jot down how do you feel when you wake up in the morning. If that journal comes back and they're jotting down they've been waking up multiple times throughout the night, then of course something like insomnia is more in the picture. So simple things, keeping a sleep journal, unplugging like you said before bedtime, turning off that phone, reducing caffeinated intake, reducing sugary drink intake before bedtime. All of these things can do a great deal towards producing a better environment for sleep at night.
Wonderful. Thank you, Dr. Anand.
Thank you.